Let's document! Join me as we cover breast ultrasound protocols. On today's edition, documenting the normal axilla. The next section we're going to talk about is the axilla, which is abbreviated AX. This is for a normal exam, and that means you've evaluated everything and it is normal. There's no pathology that you've visualized. For the axilla, you want to scan the bilateral axillas in both the low, the mid, and the high axillas. And for the axilla, you want to use the sagittal and the transverse transducer orientations. After looking through the entire axilla, if everything looks normal, then this is how you would document your images. You want to take 2 negative axilla images and you want to annotate these with which axilla, either the right or the left side, and the transducer orientation. For instance, for the right axilla, I would say right axilla sagittal and then right axilla transverse. For these 2 negative images, I take the images without any lymph nodes in the picture, just demonstrating the normal tissue that's in the axilla. And that's demonstrating to my radiologist that I have carefully looked through all the tissue that's in the axilla and I have not visualized a mass. Next, I want to carefully evaluate all the lymph nodes that I can visualize in the axilla. And usually these are going to be our level 1 lymph nodes. After I've carefully evaluated all those lymph nodes, if they all look normal, then I want to document 1 normal axillary lymph node. And this is demonstrating to the radiologist that I have evaluated all those lymph nodes and they all look normal. To document a normal axillary lymph node, first, I would document a sagittal lymph node image without measurements, and then a sagittal lymph node image with 2 measurements, both the length and the height. And note that you really want to follow the longest lie of the lymph node. If that longest lie of the lymph node is not exactly a horizontal position, that's okay. If it's slightly oblique, as long as I'm getting the longest length. And then I want to take a sagittal lymph node image with color Doppler, demonstrating that hilar blood flow pattern. Next, I'm going to move on to my transverse plane, and I want to take a transverse lymph node without a measurement, and then a transverse lymph node with the last remaining measurement, which is the width, and then a transverse lymph node with color Doppler image. Note, it's not important which transducer plane you do your measurements in. You can do 2 measurements in a transverse plane and 1 measurement in sagittal, or you can do 2 measurements in sagittal and 1 measurement in transverse. The most important thing is that you are doing a length, a width, and a height. One of the biggest mistakes that I see new sonographers making is that they like to do a length, a height, and a height. A length measurement should be horizontal on your screen, and a width measurement should be horizontal on your screen, and a height measurement should be vertical on your screen. That's how you know the difference. So you should have 2 horizontal measurements and 1 vertical measurement. If you have 2 vertical measurements, then you've done 2 heights and you are missing a whole dimension of your lymph node. Interested in more videos on ultrasound? Don't forget to like, comment, and subscribe, and tune in for our next video on Wednesdays.